Healthcare is another thing which worries Singaporeans a lot. Even those who are not ill worry about it because they've either seen somebody else ill or more likely heard rumors about somebody else ill who had a financial problem. And sometimes you hear, even in the newspapers, very terrifying stories of how somebody went to the hospital that cost them hundreds of thousands of dollars. And usually when you investigate, you'll find that there is some other story behind it, that it wasn't so straightforward, that he went for multiple procedures or he went for non-standard treatments. And it's very seldom that you have somebody who cannot afford it. And we know that because when we, as MPs, we see people, a lot of people who come to us for housing problems. We have a lot of people who come to us for immigration problems, work permit problems. We very seldom have people come to us because they have a medical bill and they want our help to waive the bill or to adjust, to make some correction to it. But the worry is there, and I think that we have to address this worry for Singaporeans and show them that, in fact, you have enough. You have enough in the 3 M's. The MediSave savings are enough. We've increased the MediSave contribution, and I think when next we have a chance, we should push the MediSave contribution up a little bit more. MediShield should give you enough protection in case of a catastrophic hospitalization, and we have been progressively adjusting that, and I think it's time for us to enhance the MediShield again. Of course, when you enhance the MediShield, you must raise the premiums, and that's necessary, but I hope Singaporeans will accept that. And we have the MediFund for people who are poor and unable to look after themselves after making their best efforts, especially old ones. So we have the Silver Fund. And I think we will enhance that too. For old folks, the worry is greatest. So what we are doing on intermediate care, on community hospitals, on nursing homes, increasing the subsidies there, I think will be helpful for the senior citizens. And I think that we need to do more progressively there because first, there are going to be more senior citizens, and secondly, I think medical care is going to advance. So the cost for treating a person who's say 80 years old will increase over time. And an 80-year-old today will probably want more medical treatment than an 80-year-old, say, 20 years ago. And thirdly, our life expectancy is going up. Men's life expectancy is now 80 for somebody who's born this year. Women, I think, goes up to 84. So, and every year, those numbers are going up by about half a year. In other words, in 10 years' time, it may be that the men's life expectancy will be 85 and the women may reach 90. And you may roll your eye, but if you are a healthy 90, or close to 90, like this lady still playing basketball in my CC, I think that's a blessing. But if you are 90 and infirm and life is and unwell and suffering, I think that's a burden on yourself and on your children. So really, we should like people to take care of their own health and stay active and fit. In terms of outcomes, we're doing well. I mean, life expectancy is high. If you look at our chronic diseases and compare them with other countries, overall, we're doing better than them. I think there was one comparison recently by Bloomberg, which ranked us the healthiest and best outcomes in the world. You must take these with a pinch of salt, but it shows that we don't have a very, very serious problem in terms of outcomes. We do have an issue with people who are worried about the problem, and we need to reassure them, and there are places where we need to do more. And I think overall we will need to spend more in terms of budget, government money, but also spend more in terms of individual savings. But remember that if you spend a lot of money, it doesn't mean you have a good outcome. The Americans are champion spenders, and their outcomes are not always good.
So right now you're spending about 1.6% of GDP on healthcare.
The government is spending 1.6%. I think overall there's about 3, something like that. About 3%. 3.5. I'm sure it will rise.
What rate do you think would be sustainable?
I think it depends what we are able to do sensibly, and to make sure that the money is being spent on healthcare which is necessary, and not on health procedures which are either unnecessary or sometimes even counterproductive. In America, a lot of it is wasted. Admin takes about 1/3 of the cost, administration of the insurance, of the red tape of the hospitals. Another big chunk of it is unnecessary procedures because the doctors want to be super careful, they don't want to be sued. Another big chunk of it is just the cost of being sued because the doctors have to pay a lot of money for the medical insurance. And every time somebody gets $1 million damages payment, who's paying for that? In fact, the patients are paying for that. So we want to avoid all those really unhelpful and bad outcomes.
Do you foresee healthcare becoming a political hot potato in the coming years?
I'm sure it will become an issue because however much you do, there will always be the desire that we do more. It's happened in all the developed countries. And there's no developed country which is happy with the healthcare system they have. They all look at one another and say the other chap's is happier. But when you go to that country, then you find out what his shortcomings are.
When that day comes when you have to persuade Singaporeans that they have to pay higher taxes, do you think the government has that wherewithal to push that one through?
I hope so. It depends not just whether the government has the wherewithal, but really whether the community, the society as collectively have that good sense to elect leaders who will tell them unpalatable truths. And there are societies where you just can't do that. I mean, if a leader tells people that you have to tighten your belt and you have to accept all these sacrifices, you can do it for a while, and after a while people get fed up and they vote you out. And in Europe they have this problem in bags. So as one European leader says, we all know what we need to do to solve the problem. What we all don't know is how to stay in government after we have done that. And that's a very big problem, and I would not say that that problem cannot happen to Singapore. It can. It depends on the population. You asked about the young generation, whether we worry about that. That's one of the things we are concerned about, because the older generation who came through independence, they have seen very unstable, turbulent, difficult times. They know how many things can go wrong. And they would say, if somebody offered them something for free, they would say, "You're xiao, crazy. Where is there anything which will fall for free from heaven, like manna?" But in many other countries, people do hope for things for free. They behave as if things can come for free. They want to vote the benefits. They will not vote the paying for it. And that is dysfunctional.